Today we will be talking about the Berg balance scale and functional reach. The Berg balance scale determines a patient's ability to safely balance themselves during a series of predetermined tasks, and the functional reach is a single item test developed as a quick screen for balance problems. Both the Berg balance scale and functional reach are meant for adults and older adults who have an impairment of balance. These impairments may be due to a neurological disorder such as Parkinson's disease, muscular dystrophy, Huntington's disease, and ALS. Due to the ease of administering each assessment, this may be implemented in almost any setting. Therefore, this assessment can be done in acute rehab, SNFs, home health, and outpatient rehab.
Some of the client factors that we found in both tests under neuromusculoskeletal and movement-related functions are joint mobility and joint stability. Under muscle functions, we found muscle power, muscle tone, and muscle endurance. Lastly, under movement functions, we found motor reflexes and control of voluntary movement. The performance skills that we found for both tests are stabilizes, reaches, flows, bends, and positions. However, the motor skill aligns is only found on the Berg's balance test. Specific areas of occupation that both assessments focus on are ADLs such as bathing and showering, toileting, and dressing. For example, when a person dresses, they need to maintain balance and reach. IADLs such as driving, home establishment management, and shop health management such as physical activity. An example for physical activity is that a patient will go into different movements which require balance and reaching. For work, you will see them reach or balance during job performance and maintenance. Under play, you will see them reach or balance during play participation, leisure participation, and community participation, family participation, friendships, intimate partner relationships, and peer group participation. The tools required for the Berg's balance test are a stopwatch, standard high chair with armrest, standard high chair without armrest, step or stool of average height, ruler, slipper or shoe, and a 15-foot walkway. Now the tools required for the functional reach test are a yardstick, duct tape, and a wall. And the space demands for both tests are warm temperature, sufficient space to allow body to move without hitting an object, adequate lighting to see the task environment, flat surface and low noise, flat surface and low.
Administering the assessment Berg balance test. Time needed is 15 to 20 minutes. The Berg balance test consists of 14 items to gain insight into the overall balance of the individual being tested. The 14 items consist of sitting to standing, standing unsupported, sitting unsupported, standing to sitting, transfers, standing with eyes closed, standing with feet together, reaching forward with outstretched arm, retrieving object from the floor, turning to look behind, turning 360 degrees, placing alternate foot on stool, standing with one foot in front, and standing on one foot. Scoring is done on a scale from 0 to 4, 0 being completely unable to do the task, 4 being able to complete the task independently. In most items, the subject is asked to maintain a given position for a specific amount of time. Progressively, points are deducted from performance if time or distance requirements are not met, the subject performance requires supervision, or the subject touches an external support or assistance from examiner.
So the first thing I'm going to have you do is take a seat on the chair that's behind you. Okay? And I want you to please stand up and try not to use your hands for support.
Okay.
Good. That would be a 4. You're able to stand without using hands and stabilize independently. Okay, for this next one, I'm going to ask you to turn and look over your left shoulder. Yep, towards that yellow pillow. Good job. Okay, go ahead and look back here. Then I'm going to ask you to turn around and look out the window. Okay. and we're going to see if you can do it for 10 seconds. Okay, I'll do it with you. Ready, go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good job.
So now I'm going to talk about how to administer the functional reach assessment. The test is easy to perform, it only takes about 5 minutes, and no examiner qualification or training is needed. First, the client is instructed to stand and position their arm next to the wall at 90 degrees of shoulder flexion with a closed fist. Examiner will record the starting position at third metacarpal head. Next, the client is instructed to reach as far as they can forward without moving their feet. The end position is recorded, again at third metacarpal head. The score is the difference between start and end position in inches. 3 trials should be performed, and the average of the last 2 should be noted.
Alright, so what we're going to do is you're going to flex your shoulder, make a fist. Alright, hold that position for me. And you're about 24. Alright, so now what you're going to do is you're going to reach as far as you can without taking a step. Excellent. Alright, go ahead and reset. Now do that 2 more times. Alright, hold that position and reset. And 1 more time. Hold that position and reset.
I'm going to talk about scoring and how to interpret the results. I will start with the Berg balance scale. Each of the 14 items or movements is graded on a scale from 0 to 4. A lower score means that the patient required some form of assistance to complete the movement, while a high score indicates independence. After all 14 items are completed, the scores are added together. The maximum score possible is 56. There are 3 main categories we can use to determine fall risk. A score between 0 to 20 indicates that the patient needs assistance to move around safely. For example, the patient may need a wheelchair and is therefore considered a high fall risk. A score between 21 to 40 indicates that some walking assistance is needed, such as a walker or cane, and this would be considered a medium fall risk. A score of 41 or more indicates that the patient is independent and has a low fall risk. For the functional reach test, the score is based on the difference between the start and end position of the third metacarpal in inches. If the difference is less than 6 inches, we would say that the patient has limited functional balance. If the difference is between 6 to 9 inches, the patient is considered moderate risk for falls and has a low functional balance. A score of 10 or more indicates that the patient has adequate functional balance.
Applying the assessments to promote occupation-based, client-centered practice. Before diving into the assessment results portion, I wanted to discuss a few advantages of occupation-based, client-centered practice, such as it works towards goals that are important to the client and therefore maximizes the client's strengths and minimizes challenges in achieving treatment and recovery goals. And with the therapist there, it offers support and positive attitude, and therefore the client may gain confidence and independence throughout sessions. Now, with the results of the Berg balance test and functional reach, we will be able to understand the client's level of function, such as their strengths and weaknesses, potentially where they favor their left or right side, also as well as pick up on common themes. Do they struggle transitioning from a sit to stand or vice versa? Are they able to step on a stool properly? Or do they struggle standing on one leg or closing their eyes to balance? Some contributing factors to consider would be age and fitness to understand common trends among their age groups, environmental demands, client perceptions and motivations, as it is important to determine their desire to improve. Blood pressure is another factor to consider, as low blood pressure can lead to dizziness, and the importance of occupations to the client, as the goal is to return them to their occupations of their daily life. With the results of the assessments, we will apply it to their intervention plan, focusing on areas they need to improve and gauging if skills are improvable or if adaptation to their daily occupations may be needed. We could incorporate ambulation devices such as a cane, crutch, or walker, as well as matching the plan to the client's daily occupations, as is very important. And lastly, we could recommend a couple of exercises to improve or adapt for their quality of life, as the importance of balance is both metaphorically and physically. Body systems that detect gravity, such as their vestibular system and proprioception, become less effective over time. And falls are the number one cause of injury and death from injuries among older Americans. Listed below are just a few examples of simple exercises that can be performed daily throughout the day.